Dr. Bejar, is an MDS-related genetic mutation something I was born with or something that occurred later on?
This is an excellent question, one that I get often in my practice. When you go see your doctor about MDS, they will often discuss the presence of genetic mutations that are related to the disease. And most of the time, they are talking about mutations that occurred in the disease long after a patient was born. So these are not things that a patient inherited from their parents, and they're not mutations that they're likely to pass on to their children. These are mutations that occurred in cells over the lifetime of the patient that accumulated and eventually led to the disease itself. So it's important to understand the bulk of these mutations, again, are things that occurred later in life. That said, there can be some mutations that predispose patients to develop MDS later in life, and these are mutations that a patient was born with. These are a little bit more rare, whereas those mutations that I talked about earlier that are acquired during the lifetime of a patient are present in about 90 to 95% of MDS patients. Mutations that someone is born with that predispose them to MDS are present in a much smaller fraction, perhaps 10 or 15% at most. So for the most part, your physician is talking about mutations that were acquired that are relevant to the disease, may actually drive it, and as Dr. Santini just pointed out, are important for understanding how the disease is likely to evolve.